Harare City Council has struggled to supply water to some suburbs for more than a decade, forcing residents to rely on water from open wells and community boreholes. Zimbabwe suffered its biggest cholera outbreak in 2008 at the height of an economic crisis when more than 4,000 people died and another 40,000 were being treated after being infected.
Before we get into the discussion of the day, let's update you on some of the top news stories around Africa. Fighting has broken out in South Sudan 2 days after the warring side signed what the government called a final peace agreement to end the civil war. The UN Security Council has asked all Libyans to improve the atmosphere for national elections in a resolution that avoids mentioning the December the 10th target date for voting in the restive North African nation. A cholera outbreak in Niger Republic has killed 55 people and sickened thousands near the country's border with Nigeria since July. The United Nations warns that the disease has spread to new regions. Now joining me in the studio to look at the issue of cholera outbreak in Zimbabwe and some parts of Africa is Femi Ogenbu, public health expert. And on Skype, I have Dr. Ifeanyi Nsofor, Chief Executive, EpiAFRIC, and Director of Policy and Advocacy at Nigeria Health Watch. Good to have you, gentlemen, on the program.
Thank you.
Now, let me begin with you now, Dr. Ogenbu. First off, we need to understand, what is cholera?
Well, cholera is just a diarrhea type of an infection caused by a bacteria. And usually the patient comes down with dehydration, and if not treated on time, could result to death on time. So that's what cholera is all about. And it's usually a disease that is usually premised on the sanitation, because it's more or less like oral to fecal route, where the food we're taking is being infected and it's in your system already.
Oral to fecal, what does that mean?
That means from your hand through the feces, through your mouth.
So in other words, once poop.
Yes, that's why in cholera breakout, you are advised when you are visiting the prone areas to be sure that the water you're drinking has sealed. Take very safe water. If not, you have to boil them. Also make sure that the feces is also buried, or you use pit latrines, and be sure that you don't defecate into water bodies, which of course can flow around again and people drink out of it, and then the outbreak starts. Like what you have in Zimbabwe now is through water. People have taken contaminated water, and already everybody's breaking down. And you know, the water source could be very long, and a lot of people are taken out of it, and before you know it, everybody's down with cholera. And sometimes if you don't test on time, even though most of the time you rarely are mistaken the symptoms of cholera with other diseases, because you see the patient coming down with frequent stooling, vomiting, and so on and so forth.
Yeah, talking about symptoms now, Dr. Ifeanyi, what are those symptoms one can really observe or see firsthand before, identifying if it is cholera or not?
Okay, I think first of all, knowing that cholera causes acute watery diarrhea, so the kind of diarrhea that is so severe and very watery, so that's a major symptom of cholera. And as a result, because of losing so much fluid from the body through your watery stools, the person becomes, severely dehydrated within hours if not treated. And that dehydration, you begin to see signs of dehydration. For example, the person's eyes will be sunken, the person may go into shock, the skin will become shriveled in such a way that when you pull it, for the skin to go back to its normal position, it takes a while. There can be signs of, arrhythmia, so the heart is beating too fast and not functioning optimally. And these are reasons why if someone has cholera and is untreated, within hours the person can die.
And that's quite worrying, but isn't there a first aid that can be given to such persons that has cholera infection before taken to a hospital, for instance, Dr. Ifeanyi?
Definitely. And I think, a remedy at home is giving oral rehydration, salt, ORS solution to the person. Because as the person is losing fluid and you're rehydrating with ORS, at least you're replenishing the fluid the person has lost while you're taking the person to the hospital. But ultimately, if indeed in a particular community there is cholera outbreak, it is not advisable to manage the person at home. It's better to take, while you're rehydrating the person with ORS, to take the person to a health facility or at least a place designated for treatment of patients with cholera in that community.
Dr. Ogoyimbo, as much as cholera, seems to affect almost a whole community, from what you're trying to explain now, water passage, anyone that drinks the water gets infected. But let's understand very well, who are the vulnerable groups here? Is it children, women, or anybody at all?
I think it's everybody, because in as much as the population is growing every day, the personal hygiene is being compromised, and more so the infrastructures are not there all the time, most especially drinkable water in all the environment. And for the case of Zimbabwe, they also have the issue of drug-resistant cases, which of course the appropriate drug to use for now is not readily available, and that will also be accountable for the reason of the loss of life that you have. Even though when you're in the hospital and the drug being administered is not really, it's being resisted. It's also an issue as well too.
And with the drug resistance, do we have any level of vaccines to prevent, cholera causing so much damage to health?
There are vaccines already. There are vaccines, but vaccines are more preventive than when it has, it has happened already. So when the patient is down and it gets to the hospital and is proven to have a drug-resistant issue, and the other alternative is not readily available.
Which is?
We have, to treat them, we have sulfasalazine and ceftriaxone. And if those two are not working, azithromycin is also very good, and that's not available in the case of Zimbabwe for now. It will also be an issue as well. So I think the government should also be on ground to always assist as quickly as possible in this kind of situation in cases arises.
Quite a situation, when we hear stories of cholera. But Dr. Ifeanyi, you own a health group and you're concerned more on this cholera, I presume. What strategies are you adopting to help, countries or areas that are prone to cholera outbreaks, for instance?
Okay, so I think for me to answer that question, I also need to put some things into perspective. There are things that have to be done at the individual level and community level, as well as at the population level. The things that you're going to do at the population level are things that we expect that government should do. So at the individual level, it may surprise you to know that according to UNICEF, about 46 million Nigerians stool in public. With the current cholera outbreak, there is an outbreak in 18 states of the country, including the FCT. So people should stop stooling in public. However, if you say people should stop stooling in public, what are the alternatives? So this is where the government and the communities come in. So do we have public toilets where people can use if they are pressed? Within communities, should community be mobilizing themselves to provide community toilets, even in communities where they don't have, such toilets? And very importantly, the diagnosis of cholera is what is called an integrated disease surveillance and response, which means that from the health facility level, when a health worker sees a patient with cholera and the person suspects it, the person records it in the form, which goes from the health facility to the local government to the state, and then to Abuja to the Nigeria Center for Disease Control. However, the handicap there is that apart from suspecting cholera, most of the facilities don't have investigating capacity, to test and be sure that the person has cholera. Because if you're sure, then you begin to mount the necessary treatment protocols that is recommended by the Nigeria Center for Disease Control. So ultimately, what is very key here, apart from the role of government, is communicating, risk communication, behavior change communication to our people. We cannot keep stooling in public and expect that we don't have cholera. We cannot keep stooling, even if you stood in a fancy toilet and you don't wash your hands very well, and if you had cholera, you can easily spread it to people. I remember that some people can actually have cholera and not have watery stool. It's in their stool, and if they don't wash their hands, they can spread it easily. So very simple, basic things that should be done by the government, communities, and people. In the 21st century, it is an abomination for people to still be having cholera. And I like the way that the WHO rep for Africa put it, Dr. Mweti, that is a disease of inequity.
Right.
Because if you look at places with cholera outbreak, they're not high places of affluence. They're usually in poor communities or places where people are overcrowded, IDP camps, migrant camps, and things like that. So I think we should really do better to stop people from dying needlessly from cholera.
Yeah, talking about doing what we have to do, on your own part, how much have been done with regards to creating awareness on this disease outbreaks?
Okay, so for us in Nigeria Health Watch, this is something that we do because the core work that we do on our Nigeria Health Watch platform is health communication and health advocacy. So communicating to the people, through radio, through social media, through, weekly thought leadership blog series that we do on the basic things that they can do to prevent cholera. And even when it happens, what they should do, the places they can seek care. And we partner with the Nigeria Center for Disease Control also to say, okay, how do we improve risk communication to Nigerians? But most importantly for us is to hold government accountable, because ultimately it's the place of government to provide some of this, these social amenities that we're talking about.
Right.
So to consistently, keep government, on their toes to ensure that they provide what it is they're supposed to provide and prevent people from dying, unnecessarily in the 21st century because of cholera.
Absolutely, but let's quickly go on a quick break now. When we come back, we have more to discuss on this disease outbreak, cholera, in Zimbabwe and other parts of Africa. Stay with us. Welcome back. Zimbabwe's police recently issued a ban on all public gatherings to control the spread of cholera, which has killed more than 20 people in the capital, Harare. The move comes a day after the government declared an emergency following the outbreak of the disease. Now, Femi, this is quite a measure taken by the Zimbabwean government to well contain the spread of cholera. And rightly put by Dr. Ifeanyi, it's not just, providing these facilities, more or less pit latrines or basic toilet needs, but people should take hygiene into their own hands. But in as much as this is what it should be, what are the likely implications now if this disease outbreak isn't well managed?
Well, it's going to be very disastrous if it's not well managed because of the likelihood of the fact that it could spread further, and it becomes more difficult to curtail if it spreads further. That's more reason why even now it's rather better to be nipped in the bud by all necessary hands to be on deck. I mean, the government, the individual, and everybody concerned should make sure that anything they need to do to get out of this situation now should do it.
So what's the worst case scenario?
Well, the worst case scenario, you don't want to imagine it if it's left uncontrolled. That's more reason because you cannot restrict people's movement. Even as much as you are not allowing gatherings again, people are moving from countries to countries. And you might be surprised that within the periphery of that outbreak, there could be, a blowout of these infectious diseases. I'm
trying to understand this here. Is it that it's so transmissible that if anyone has a cholera, I wouldn't know, and if I shake the person, I just contact it? Or exactly, let's understand this here.
Like I've explained earlier, I said it's through oral and fecal means.
Right.
For instance, what you're putting into your mouth and the places you're passing out. These are the areas where the bacteria resides. Take, for instance, like the doctor said earlier on, if we continue to defecate on the surface on water bodies,
right,
whereas these waters are also flowing into different areas and people are drinking it and they're getting reinfected. Even if they've just been cured, again you are infected. Then it's a continuous process. The more reason why when it happens like this, we should put all hands on deck in terms of creating awareness. The necessary people that are infected should be taken to the hospital and treated. If there is issues of resistance, the available drug should be made available. And the government should also look at that environment where the population is surging high to provide the basic amenities, most especially latrines and potable water. This will help in seriously, condoning, the spread of this disease.
So, Dr. Ifeanyi, do you share the same sentiments with Femi Ogembu?
No, absolutely. Because there's so much you can do to restrict movement. According to the US CDC, if you have an outbreak of a disease in a village, within 16 hours, it gets to major cities because people travel by air. And, within hours, you've crossed all sorts of continents to different places. So there's very little you can do to stop people from moving. And that is why risk communication or behavior change communication is very key. And for us at Nigeria Health Watch, it is very important for us not to wait until we have an outbreak for us to do this, because it's almost like a knee-jerk approach that we do all the time on the African continent. We don't provide people with the right information until there's an outbreak. Because if we did, most likely we won't be having as many outbreaks, as we have currently. Yes, 20 people have died in Zimbabwe, but in Borno State here, 18 people have died. And cholera has spread to eight local governments in Borno. So it is just so unfair, because when you look at Borno as an example, people are already suffering from the effects of the insurgency, and they have congregated in IDP camps where sanitation is very poor. People are still stealing in public. Water provision doesn't reach to many people as it should. And, for somebody to run away from his village, get to an IDP camp to get solace, and then be killed by cholera, I think it's just so unfair. And this is why this behavior change communication must happen before. It must be an ongoing thing all the time, so that we're not responding only when we have outbreaks.
And it's really a sad one, if I would say. But if your position now on African countries having this knee-jerk approach now, Dr. Ifeanyi, what level of preparedness should we be looking at if we are talking about having to stem or put this, outbreak in the bud, as in to control it totally altogether?
Okay, so we have to take healthcare to people where they live in the communities.
Right.
More people live in rural communities in Africa than live in urban centers. And if you look at what Dr. Tedros, the WHO DG, did when he was the Minister of Health in Ethiopia, they employed young people that just came out of school as kind of health extension workers, give them the right education to begin to educate community people about basic things like, sanitation, about going for antenatal care and stuff like that. Because the solution to this is very basic. But what happens is that we leave it until things get out of hand. So we must keep communicating this. Health workers at the community level, at the state level, must keep doing this. This is something that the Nigeria Center for Disease Control, Dr. Chikwe Hekwazo and his team, emphasize all the time. We have to keep on communicating the risks of diseases to people so that people are not taken unawares. Different countries where, even in Nigeria, I know different CSOs working in different communities, mobilize community members to see the dangers of open defecation. And as a result, these communities will build toilets, that community toilets that they will maintain themselves, because the NGOs have been able to link to them their behavior and disease occurrence in their communities. This is something that has to be widespread. It's not just the curative aspect. The preventive aspect is very, very critical. Indeed. And risk communication is really, the key to doing this. Yeah, rightly said. Prevention is better than cure. Femi, any more to add in terms of hygienic measures one can adopt here so that we can, at least help ourselves? Well, the first thing is that the government should also endeavor to always be prepared whenever you have issues of like the IDP camp, insurgents in areas where you have people living in the rural areas. These people have been living in their community for over the years. We should find a way, if we cannot bring all the social amenities to them, at least let us make sure that they have public toilets and good water. This alone will be a step in the right direction towards taking care of all this issue of outbreaks. Otherwise, we'll continue to do the fire brigade approach all the time. Absolutely. And for vaccination remedies? Of course. We need to reach out. The logistics should be deployed towards getting to all the nooks and crannies of the country and preparing them towards it. Especially when you have people, in the case of IDPs, we should be prepared. It's not until the outbreak comes before you start preparing them towards all these things. Immediately the IDP is set up, the medical unit is there, and the awareness is also being created continuously to make sure that people have a way of life and understand the implication of personal hygiene
how it affects not only them, but the entire populace.
But it is curable, right?
It is. It is.
But it's just the way it takes one's health, as in, without constant check, one can just die of.
You know, like I said earlier on, this is a watery diarrhea that keeps you constantly dehydrated. And if not properly attended to, you could lose your life.
Wow.
So, but if you have adequate treatment on time, I mean, you get out of it.
So, Dr. Ifeanyi, to put it in a nutshell now, what's your final take on this? Where do you think the government should come forward? You know, you've said a lot on what the roles of government should do and the people and all of that. But on the large scale now, where do you see Africa in 50 or 10 years from now, perhaps, you know, dealing with cases like this?
Okay, you know, coincidentally, a few days ago, the African Union made a commitment, African governments made a commitment to reduce, you know, the burden of cholera by 90%, you know, by 2030. That is basically, you know, 12 years from now. So it is very important for African governments to realize that this should move from talk to actually doing the actual work. And the actual work is we need to provide clean water to everybody on the continent.
Right.
And they need to provide, you know, toilet facilities, you know, and ensure that even when people build homes, for example, you know, even in Abuja here in the outskirts, you go to communities where landlords build houses and there are no toilets in the houses. So where are the people supposed to stool when they feel the urge? Right. So even ensuring that building plans are adhered to and stuff like that. And African governments must realize, African Union, this Africa Center for Disease Control, and everybody involved here, that we cannot keep depending on the donor community to come to our rescue all the time.
Right. We
have all the resources within the continent to be able to prevent Africans from having cholera, you know, going forward.
And that's fine to put it that way. Thank you very much, Dr. Ifeanyi Nsofor, for your contribution on Africa Today. And Femi Ogenbo, I appreciate you and your contribution as well on the program. Thank you so much.
Thank you, Esther.
As the world pushes towards a healthier planet for all, Africa continues to play catch-up, where institutions are struggling, infrastructure is degrading, and intervention remains poor with respect to disease outbreak and control. With the challenges in Africa's health sector set to be more daunting than ever, policymakers and key players must reboot the system to effectively reduce the devastating effect of preventable, communicable diseases like cholera once and for all. And that is our package for tonight. But don't forget to join the conversation as usual on Twitter at TVC News NG, and follow me for updates around Africa at Esther TVC News. Until the next one again, I am Esther Omokwariola, and always remember, Africa can only get better.